to you both, Carl and Lindsey. Thank you so much for coming to talk to us today about the Attachment Trauma and Mental Health PGCert. Could you tell us a little bit about what you feel the highlights have been on this course for you?
For me, it's just been speaking and being able to work alongside other colleagues from education backgrounds, other colleagues from health backgrounds, and just being able to research a newer area and find out a little bit more about a new area that I was interested in beforehand, but being able to kind of back that up with the most up-to-date research and theory about that.
Yeah, I'd agree with that. Getting a deeper understanding of things that I already thought or saw or practiced or believed from what I'd seen in mental health, but also then seeing how that is applicable across other contexts as well, such as education, and those parallels between healthcare and education and where they cross over and where we can learn from each other. Being
given that space to kind of discuss and share our ideas, share our experiences, and how this is applicable in our settings and other settings is really helpful and a positive.
Yeah, the depth of knowledge for me has been really helpful. So the understanding of the neurobiology behind some of the ways that people act, how behaviour is communication, where that comes from. And I think one of the biggest things that I learned is that some of the things I believed were myths, like this idea of show me the child till 7 and I'll give you the man. And it's actually, there are so many different opportunities to change somebody's potential outcomes across their life course.
And I think that for me, that side of it, seeing the science side of it, is something that I've not got a real scientific background of it, so seeing that side of it, where it comes from, has been a real eye-opener, really, yeah.
So what led you to apply for this course initially?
I had an interest in trauma-informed care from working within mental health settings, because when it was first introduced to me, and it was a very glancing introduction as a concept, it revolutionised the way I was able to work with patients. I could understand them differently. I was able to interpret their behaviour differently. I was able to take so much less personally of what they were saying and what they were doing. And so what I could see from that is, as I've moved from clinical nursing to nurse education, this is something that doesn't just apply to mental health, it applies across all domains of healthcare, nursing and allied health professionals. And getting people to take that approach just helps them provide better holistic care, I think.
Yeah, we had somebody visit our school and delivered a bit of some training around trauma-informed practice, and also I had a couple of colleagues who was working alongside Chester University with a research project around trauma and attachment. And again, it was just something from speaking to those colleagues and from that training that I was really interested in developing a little bit further, and then saw that this was a possibility, something that I could do alongside work, and I just thought it would be something that would be beneficial for myself, but also for the children and the school and the community that I work within.
So how is the course flexible?
So we come into campus, I think it's one day roughly every 8 weeks, and then between those times we have an online session on a Friday evening. So yes, there is a time commitment involved in terms of independent research, but in terms of actually blocking out your diary time, it's not too much pressure, and then you can self-pace the rest of your learning, and I think that's been really helpful to work around any other project I've had on.
Definitely, and for me it was definitely important, the time coming into university, although, you know, like you say, it's a day every 8 weeks, but it was important for me with family, with work, to be able to have that specific time to come away, give myself that headspace of learning time. But then, as you said, everything else around it's really flexible, so then you can kind of work your hours to what's, you know, what's good for you and what you can fulfill.
Yeah, because I've done a full-time master's in the past, and the level of guilt I felt stepping away from practice every week when things were busy, whereas this is like, okay, it's on a Saturday, I can manage my own time around that, so that's been really good as well.
And also what's good about it as well is the fact that the things that you are learning, you can apply straight away.
Oh, yeah.
And that's the best type of training or learning, is where you can use those skills straight away in the practice.
Yeah.
So what would you say the impact of the course has been on your professional role?
Yeah, so still being a class-based practitioner, the things that we've been learning, you know, week in, week out, I've been able to take that back to the classroom, try those things out, and you know, reflect on children's communication and why certain things might be happening. In addition, as well as a leader as well within education, kind of we've been looking at it as a whole school policy, and how we can use that to, you know, direct you know, learning and within the whole school, and how that impacts on policy for the school and for the wider community.
Yeah, similarly, I've taken things that I already thought that I knew and been able to find new ways of explaining it so that it's more accessible to people. They've been able to take that information, use it. I've then been able to explain things in a way where I've seen people go, oh, that, yeah, I can see how that would work. Things as simple as talk people through procedures when you're taking their blood pressure, because you don't know what that sensation is reminding them of. And they go, oh, so it's not an extra thing that we've got to do. And it's like, no, it's just a slight mind shift. It's just a different approach.
Also, I mean, it's for me, there's been some light bulb moments just for personal things, you know, with my own children, or just in everyday life, thinking, oh, well, that's why somebody's reacted like that, or that, you know, yeah.
So how do you feel this qualification will help you in the future?
For me, similar to what we've just spoken about, kind of, you know, impacting on my practice here and now, the direction of the school, and the policy for the children, for the parents, for the community. Personally, for me, it's reawakened, you know, that love of learning in myself personally as well, and you know, I want to kind of take that forward now and complete a master's as well myself, and if I hadn't have started and done this, I wouldn't be thinking that now. So that's definitely something.
It's nice to hear that teachers still have a love of learning, and it hasn't been knocked out of you.
Yeah.
For me, there are so many levels to it, because, yeah, on a personal level, it gives me so much more understanding of myself and of the people around me. As somebody supporting new practitioners, it's about improving their practice and what they're then able to do out in the world. As a manager of my team, I take trauma-informed approaches to my management and supervision of my team, and to understand their behaviours and what their behaviours are trying to tell me on that professional level. And then I'm also in a position where I can potentially influence policies and strategies that gets this more integrated. And again, it's about having this as a topic that is more spoken about, more accepted and better understood is what I'm hoping to get out of this, having done it.
Yeah.
So do you have any tips for students thinking about applying for this course?
Absolutely do it. If this is something that has crossed your mind as even a possibility, a nice to do, a maybe, go for it, because you will get something out of it. It is absolutely worth the investment. Self-development is not selfish, and in any sector, in any profession, with any level of interest, you will get something from it, and you'll be surprised at how much you learn. You'll be surprised at how much you already know, but now you get to understand more. So yeah, it's an absolutely fascinating topic, and I think everyone should do it.
Yeah, definitely. And I think like the point that you made, you know, its application is really broad. I mean, education and health, yeah, but you know, the knowledge that you gain from this could be applied in any walk of life, and it kind of does support a lot of things that you might know or you think you know, but it will back that up with the science behind it, the research behind it, and really does give you that confidence in what you feel and what you're talking about moving forwards.
Thank you both very much.
No, thank you.